Imagine this, you're going about your day, feeling fine, when you go in for a routine health check, and your doctor says, you have a heart block. Instantly, questions pop up in your mind. What does that mean? How serious is it? Most people think of the heart as this well-oiled machine that just works. But when you have a heart block, it means the machine isn't working as smoothly as it should. Even if you don't feel it, and even if it's mild, understanding what a heart block is and why it matters is essential. What is a heart block? Let's break it down. Heart block is a type of arrhythmia, which means the electrical signals in your heart aren't moving the way they should. The heart relies on these signals to keep a steady beat, pumping blood through its four chambers, the two atria at the top and the two ventricles at the bottom. Typically, the signals travel seamlessly from the atria to the ventricles through a small bundle of cells called the AV node. When you have heart block, though, the signals are delayed or blocked as they pass through the AV node. Imagine trying to listen to your favorite song on the radio, but the signal keeps breaking up. That's essentially what's happening inside your heart. Heart blocks come in 3 degrees, with the first degree being the mildest. Here, the signals are just a bit slower getting through. You might not even notice anything different, and in most cases, first-degree heart block doesn't need treatment. But let's explore why it happens, and what it could mean for you. Causes of first-degree heart block. So, why do these electrical signals slow down in the first place? There are a few reasons. 1. Age. As we get older, the AV node can develop fibrosis. Basically, it gets a little thicker and stiffer with time, just like how your favorite pair of jeans might fade and wear down after years of use. 2. Health conditions. Certain medical issues, like heart disease or high blood pressure, can impact the heart's electrical system. Sometimes even taking specific medications, like beta blockers or calcium channel blockers, can cause a slowdown in those signals. 3. Congenital factors. Some people are born with heart block. This is called congenital heart block and is quite rare. Think of it as a wiring issue present from birth. And did you know? Heart block is more common in athletes and men over 60. This doesn't mean it's a serious problem, but it's something to watch. Symptoms, or lack thereof. Here's the surprising part, most people with first-degree heart block have no symptoms at all. It's usually found by accident during a routine test called an electrocardiogram, or ECG. This test measures the heart's electrical activity, showing if the signals are moving slower than usual. But even if you're feeling fine, first-degree heart block could be a little sign from your heart that it needs some extra attention. Why? Because heart block can progress. So, if you've been told you have this condition, you'll want to keep an eye on it through regular checkups. Second and third degree heart block, a progression to watch. Second and third degree heart blocks are more serious. Second degree heart block, here, some signals don't reach the ventricles at all. This comes in 2 types. Mobil's type 1 is like a game of telephone where the message keeps getting slower until it's dropped altogether. This type might make you feel dizzy or lightheaded, but it's not usually life-threatening. Mobil's type 2, though, is a bigger concern and can lead to symptoms like fainting. Third-degree heart block, this is the most serious type. At this stage, the signals are completely blocked, meaning the heart beats unpredictably and the body may not get enough blood. Third-degree heart block can cause chest pain, extreme fatigue, and shortness of breath, requiring immediate medical attention. Diagnosis and monitoring. If you're told you have a first-degree heart block, what happens next? First, don't panic. Doctors will typically monitor your heart over time. This could involve regular ECGs to check that the block isn't worsening. They'll also talk with you about your health history and do a physical exam. Most people won't need treatment, but if you're one of the few who experience symptoms, a pacemaker might be recommended. This small device, placed under the skin near your chest, helps your heart keep a steady beat. Think of it as a backup drummer in a band. When your heart misses a beat, the pacemaker steps in to keep the rhythm going. Prevention and heart healthy habits. Let's talk prevention. Now, you can't always prevent heart block, especially if it's congenital. But there are steps you can take to keep your heart as healthy as possible. 1. Exercise. Regular physical activity helps strengthen the heart. Just 30 minutes a day can make a big difference. 2. Eat a balanced diet. Foods rich in fruits, vegetables, whole grains, and lean proteins support heart health and keep cholesterol levels in check. 3. Avoid smoking. If you smoke, try to quit. Smoking damages the heart's electrical system and raises blood pressure, increasing the risk of heart problems. 4. Talk about your medications. Some medications can slow down the heart. If you're taking medicine for high blood pressure or another condition, talk with your doctor about the risks and benefits. By embracing these habits, you're not just supporting your heart, you're supporting your entire body. Why it matters, the potential risks. First-degree heart block is generally harmless, but there are some potential complications to be aware of. For instance, if you experience fainting spells, you could injure yourself during a fall. And if the block progresses, it can lead to issues like low blood pressure or even a heart attack in extreme cases. That's why regular monitoring is so important. With a little extra attention to your heart health, you can live a full, active life, even with a first-degree heart block. When to seek medical help. If you notice symptoms like fainting, dizziness, or unusual fatigue, reach out to a doctor. Remember, heart health is crucial at every age. Routine cardiovascular checks are recommended for everyone starting at age 20, according to the American Heart Association. Most people with first-degree heart block never experience symptoms. But it's always wise to stay informed and proactive about your health. Final thoughts: living with first-degree heart block. First-degree heart block isn't the end of the world. Think of it as your heart sending you a memo: hey, let's keep an eye on things. By staying informed, monitoring your health, and leading a heart-healthy lifestyle, you can live a vibrant, active life. Your heart is your body's powerhouse. So, listen to it, take care of it, and it will keep you moving forward, one beat at a time.